Good morning, everyone who's just joining us. My name is Garrett Sheehan. I'm President and CEO of the Greater New Haven Chamber of Commerce and Quinnipiac Chamber of Commerce. We have Josh Geballe with us, and we're going to get started in just a couple of minutes. We'll let everyone get into the webinar. Good morning again. My name is Garrett Sheehan, President and CEO of the Greater New Haven Chamber of Commerce and the Quinnipiac Chamber of Commerce. We're joined today by Josh Geballe. We'll get started in just a moment, but I again want to thank you all for joining us. I want to thank all of our investors who support the Chamber, especially during this time period as we go through the coronavirus. It's with their support that we are able to continue to provide the programming that we've had over the last several weeks, and we are going to continue to bring you new webinars as we go through the crisis. We're really pleased to have Josh with us. For those of you who had signed up back in, I think it was March, we were going to have Josh come visit with our Government Affairs Committee. At that point in time, we were going to talk about the Department of Administrative Services, of which Josh is the commissioner. But during that time frame, he was promoted also to Chief Operating Officer for the state of Connecticut, working in the governor's office. Obviously, the situation started to change very rapidly back in early March, and so we shifted gears, and we're really glad to be able to have Josh join us now. And Josh, thanks for taking the time to be with us today, and I know you're very busy at the governor's office. Why don't you start by just giving us an overview of what's going on inside the governor's office on a day-to-day basis to deal with the crisis?
Sure. Well, first of all, good morning to everybody. And, before I start, I want to thank the business folks on the phone and your other stakeholders at the Chamber. I know it's an incredibly difficult time for everybody, but especially for folks, running small businesses, having to deal with difficult, shutdown situations, dealing with your employees. It's a brutal time for so many people, and I know most of you are really dealing with that head on right now. And so, thank you for your support and leadership through this. Garrett, so to your question, I'm at the Capitol right now. The Capitol for quite a few weeks now has basically been a ghost town. There's really only about 4 or 5 of us who, and the governor's senior staff, who come in every day. Governor comes in the afternoon and does the briefings, as you know, but we're typically on Zoom or on conference calls with him most of the rest of the time. And then our emergency operations center has been operating also with a skeleton crew physically in place at the Armory, and with most people working remotely as well. So it is a very strange time. The Capitol building is a beautiful place, and it's an incredible place to be when the legislature's in and it's buzzing here. And when it's a ghost town like it is right now, it's really, it's pretty remarkable. But, we've all got modern technology. We're moving everything forward, but it's definitely different circumstances. It is for everybody.
And I just want to let everyone know you can put your questions into the question and answer area or the chat as well. And also thank you to our streaming partners, the Bridgeport Regional Business Council and the Chambers of Central Connecticut. Josh, can you talk a little bit about the spread of the virus, what you're seeing in Connecticut? Obviously, it really first started to be strong in Fairfield County, but it's been growing in other parts of the state as well.
Sure. Yeah, I don't know if most people, it sounds like these days, are kind of following these daily briefings, and many people remember, I think it was 2 Fridays ago, we devoted one of the briefings to the modeling that we had been doing and a lot of the different models we've been looking at. And at that time, we made some forecasts, or gave our kind of best estimate that we did think that there would be kind of this rolling set of peaks in Connecticut, as you said, Garrett, starting in Fairfield County, which was certainly hit first and hardest so far, and that we would anticipate the apex of the infections and hospitalizations there occurring kind of in the 3rd week of April, so kind of next weekish kind of time frame, with New Haven County coming a week or 2 after that, and then Hartford County a week or 2 after that. And I think we're seeing the data play out in a way that's pretty consistent with that right now. We did make the point too that through all the work that people are doing around social distancing and all the sacrifices people are making to try to stay home, try to limit in-person interactions, that we could, bend that curve as well, bend it down in a way that helps protect our healthcare system, that helps save lives ultimately. I think everyone has seen the bend the curve kind of classic epidemiology graph where you could have that big steep spike, or if you are successful in bending the curve, that does have some effect of kind of spreading it out over a longer period of time as well. So that's the piece that remains to be seen around. I think there's enough evidence over the last week and a half that we're making progress bending that curve. I think our hospital systems are handling they've made great preparations. They're doing an excellent job. What none of us really know right now is what that means for the time horizon around that apex and when it starts to really not just level off, as it has shown some indications of starting to do, but hopefully start to go down at some point, in the next couple of weeks here.
What have you seen from business? Obviously, a lot of changes in how business is done, many shut down, but have you seen businesses responding in appropriate manner? I know we've spoken to a lot of them that are, if they're open, they're doing temperature testing, other things like that. Is that the same thing that you're seeing at the governor's office?
Yeah. I'm sitting in my office right now by myself, so I don't have my mask on. But when we get together here, we're wearing masks, and everybody should be wearing masks at this point when you're around other people as much as possible. Even cloth masks. The CDC website has some tips for how to make a mask out of an old T-shirt you can cut up with a pair of scissors. I mean, people who do the risk modeling on this stuff will tell you that even an imperfect mask that cuts down the risk of transmission and the airborne particles fractionally at small percentages, when you compound that out across the population, actually can have really meaningful benefits. And so, yes, masks is going to be a part of our lives for quite some time, I'm sorry to say. The businesses and organizations that are doing temperature checking makes all the sense in the world. Getting those early interventions, getting people out of circulation when they start to become symptomatic is really important. And then the social distancing, right? We've put in place a lot of executive orders around making sure that the essential businesses that have had to stay open are making sure that their workplace is taking the right precautions to limit the transmission wherever possible. And so, definitely for all your members, everybody else out there, that to the extent you can embrace those guidances and really be aggressive about them, that's going to help us get the infection rate down. That's going to help us start to get the curve going down. And once the curve starts to go down and you get your arms around this, that's when you can start to talk about relaxing some of the restrictions we have in place in a controlled fashion that isn't going to result in another blow up.
One more question on the health side. How is the capacity look at our hospital system? We know we have a strong hospital system going in, but this is obviously something very different.
Yeah, our hospital system has done an amazing job, I think, of getting prepared for this. We talk to the hospital executives every day. They have all rearranged their facilities, dramatically increased their ICU bed counts, their ED capacity. We've been bringing in more ventilators, and they've been managing. It's particularly in the southern and southwestern part of the state, it's very busy in our hospitals right now. But none of them are overflowing. We do have a lot of surge capacity set up, none of which is being used currently, and we hope it never gets to the point where we have to use it, but we're prepared if we do. So our hospitals and our nurses and doctors and everybody in there has been doing just an amazing job, and really fighting through some challenging times, but anticipating that it could get worse before it gets better. And I think they're prepared.
Reopening has kind of become the topic over the last several days. I know everyone wants to get back to work, but they also don't want to give up on the great progress that we've made. And we've done a survey of some of the businesses, and even though how bad it is, just reading the comments about how everyone's customers and revenue streams have completely closed off is really sobering. I know the governor made some announcements this week. Talk us through a little bit how you guys are going to go through the process of getting things starting to open up again on some level. Yeah.
So, the governor announced on Monday, I think it was, the appointment or that we've created an advisory group that is going to help us think through the strategy for this. And it's going to be about a 50-50 mix of people with business and economic backgrounds, as well as people with scientific and medical backgrounds. And, everybody, we've been meeting multiple times a day around the clock. We finished up at about 11 o'clock last night. Everybody wants to get back to work as fast as we possibly can. Like there's no debate or confusion about that burning desire that we all feel for all of the reasons that I know all of you feel. And what we're trying to figure out is, what are the conditions that we need to have in place to be able to do that safely? And what are the dials that we will turn and in which order to be able to start to step our way back towards something resembling normal over a period of time, recognizing that no one thinks we're going to have a vaccine for this thing for probably a year, best case. And so between now and then, it's going to be very tricky, and we know that's going to involve a lot more testing, a lot more contact tracing, so that we get our arms quickly around the infections that do occur, around making sure that we've got adequate PPE, that we've got all the other infrastructure in place that we're confident as we start to loosen it back up that we're not going to be immediately back in the same position we are now, which would be, frankly, even more devastating, I think, than what we're all experiencing at the moment, if you can imagine that. So we've got the right experts. I think we're fortunate in the state of Connecticut where we got.
I think Josh's screen has frozen for a minute, so we'll just pause and see if we can get him back on. But as he was saying, we're talking through right now what it would look like for a reopening and how we get the government or get the businesses, back open. And I know that's a question on the minds of a lot of folks who are on the webinar today. It's a big question for us at the Chamber and how we start to get some of this activity going again. So just give us a minute as we try to get Josh back up. I saw his face freeze first, but the audio kept going, so I thought we were going to be okay. I think he'll try to dial back in here in just a moment. And again, if you want to put your questions into the Q&A and the chat area, we will take those, and then when we get them back up here in the next moment or so, we will run through those. Again, starting to see a lot of the questions. We are going to ask them about the Department of Labor, because I know that has been an issue, especially around the computer systems and getting people processed through unemployment as well. We'll also touch on some of the things around business assistance, because we know that's an issue. Many of those are federal programs, so the state doesn't have a lot of involvement there, but there is definitely a role that the state is playing as some of these things come about. So just give me one moment and I'll see if we can get him back logged on here. Again, we're just trying to get Josh logged back on, and then we'll continue with the webinar. Appreciate everyone sticking with us and your patience on this. Technical issues from time to time do pop up with these webinars as we try to do them, so we try to handle them on the fly as we can. We'll just give it another couple of minutes, and hopefully we'll have him back online. While we're doing this, we'll let you know that this afternoon at 4 o'clock, we're having our Leadership Greater New Haven graduation. So please feel free to join us. And it looks like we've got Josh coming back on. So Josh, can you hear me?
All right. Yes.
All right.
Sorry about that.
No problem. It works. So we were just talking. I know we were talking about the restart, how that's done. I've seen some questions in the news media from last week. The governor extended a lot of the closures to May 20th. I've had some people ask me, well, can that be more targeted towards specific regions where there's where it's a hot spot right now? What has been your guys' opinion on how you do that? Is everything going to be a blanket, or are there ways to kind of break out different areas or different regions?
Yeah, it's a great question. It's something the team is thinking about and looking at. We don't have answers on that right now, but it's obviously desirable to the extent it's possible to loosen up sooner in areas where the risk is lower. It's just we're a small state. Things are very interconnected. Our governor is very concerned also about cross-border impacts. We think about all the population that lives within 10 or 20 miles of the New York border, for example, and if we do something and they don't, or vice versa, and you have a bunch of people charging across the state lines to get into a restaurant or something that's been opened up, this is all the stuff that we got to coordinate very carefully. So people are certainly thinking about that, and like I said before, everybody has the same desire, which is to get back to normal as quickly as possible, but just doing so in a way that's very carefully monitoring the risk of every action we take is got to be central to this.
I know you're on a tight schedule, so we're going to start going through some of these questions. We've had a lot of questions about the financial stimulus package that's out there. I know that's a federal program. Obviously, you're on the state side. The state has offered some programs. Anything that you guys are seeing with that money getting distributed? I know that all of our banks have been very involved in getting that program out there, but any comments from what you guys are seeing on how that PPP and other programs are actually getting out to business?
Yeah, David Lehman has been watching that closely for our administration. I mean, we know that, some banks got out of the gates slowly, but Connecticut, so far from what we can tell, has been, getting applications in for kind of more than our fair share of the federal bucket when you look at it as a percentage of the number of businesses that we have or population or other metrics. So it seems like our business community's gotten out fast trying to access that funding. We're hearing that, it's going to be oversubscribed, and there's a lot of dialogue in Washington that there could be more funds coming to help expand that further. So, like a lot of the stimulus or the federal programs that have been put in, it's just, in many cases, it's taking too long to actually get money out to people into their bank accounts so that they can, survive right now. And there's a lot of effort going on both at the state level and the federal level to get the money flowing.
Josh, one of the topics we originally were going to talk about was modernizing state government. I know that's come into play in a big way at the Department of Labor. And with the just overwhelming amount of unemployment claims, other questions that employers have about shared work programs, things like that, and the computer system that's in place there just cannot keep up. Can you talk a little bit about Department of Labor, how you guys are trying to relieve that backlog?
Yes. So, as people know, there's been a number, there's like the traditional unemployment benefit, and then there's been a number of enhancements that have been added. And, there's a different answer to your question kind of for each of those. For the base benefit, there's been, I think as of yesterday, it was 360,000 claims filed, a staggering number. The team is the old-fashioned way, let's say, has processed through about half of those already. So there's, I think, $50 million or something that's already gone out to people, but still a lot of people waiting for that first check. And we've been working on, working off the system you alluded to, which is a 40-year-old mainframe backend, which, by the way, when this whole crisis hit, we were halfway through a project to replace that thing, sunset it, and put in place a more modern system. if this crisis had happened a year from now, we would have been much better off. But it is what it is, and the team has looked at some creative options to basically force process bigger batches rather than have to go through them manually as they are today. And actually, we'll be talking about this at the press conference this afternoon. I think we're getting very close to the point where we'll be able to get caught up on the kind of normal benefit, if you will. Then there's another system change that has to go in place, which is being tested now to provide that extra $600 benefit, which goes on top. And so that should be not too far away either. And then for people who are self-employed or entrepreneurs and are looking to access the new pandemic unemployment assistance funding, that unfortunately requires in Connecticut, as it does in every other state, us to stand up a brand new system to support, which in peacetime is an undertaking that would be measured in multiple months. But we've got a plan in place that we're working around the clock to try to get that new system stood up as quickly as possible, hopefully more like in a matter of weeks, to be able to get that benefit out, because that is a brand new benefit, brand new program, and unfortunately the current system doesn't have any capability to be able to deal with that. Every state is in the same boat on this one, not to make anyone feel better about it, but we are collaborating with a couple other states on a build to help get some critical mass and make it go faster.
Should people start to expect to see the backlog get cleared through in the next week or so? Do you have a timeline kind of on how things will get cleaned up?
Yeah, we'll talk more about that in the press conference this afternoon. I mean, I think for the traditional benefit, yeah, that kind of time frame is becoming increasingly realistic. For the pandemic unemployment assistance for the self-employed, that's going to be a little longer. I mean, we're still several weeks out from being able to go live with that system and get the money flowing out to people, unfortunately.
Questions about testing, if we, where we're at with the testing, if we I know it's been ramping up over the last several days. What can you tell us about testing? And I have seen that we've had some Connecticut companies, SEMA4, others that have stepped in to help out.
Yeah, it has been ramping up. Semaphore has gone online last week. Jackson Labs went live a couple weeks ago. All of our larger acute care hospitals are doing testing in-house. We've got some other companies coming online with the rapid Abbott diagnostics. CVS has been in the papers. They're going to be coming online with a drive-through clinic in New Haven shortly. Rite Aid is coming in as well. So, listen, the business people on this phone, people understand how capitalism works. When you have a big mismatch between supply and demand, the supply catches up eventually, the innovation fills in the private sector, and we're seeing that happen. It can't happen fast enough for any of our tastes, but the resources are there to support it. It's a question of capacity. And so, on any given day, as the supply chain fills in, you have a shortage in one commodity or another that's kind of becomes the bottleneck that holds you back. And over the last couple of days, it's been test swabs, the swabs that go way up, into the nose, and it feels like the back of your brain for people who have done it. Those things are in short supply, and the transfer media, the collection kits to get those to the labs. We got a lot of lab capacity to do more testing, and now that collection is the bottleneck, and that'll get eased, and then we'll be on to the next one as the capacity continues to ramp up. So every day is kind of hand-to-hand combat on the supply chain and where the shortages are and how we get the capacity up. But it's happening, and we need it to happen faster, and that's what we spend an awful lot of time working on.
Josh, I think you touched on some of this, but we still have a lot of questions. What are some of the benchmarks you're going to be looking at, the governor's staff, for doing these reopenings or lightening up some of the restrictions that are out there right now? What are the kind of key indicators that will start to allow you to make progress on that?
Yeah, we're looking at a lot of them. I don't want to get ahead of the advisory group's work. We'll be talking about that more in the next couple of days. There's a lot of research reports that are out there right now. I think a lot of people kind of circling around a lot of the same concepts. I don't think you'll see anything that's too off the beaten trail. I think there's a lot of consensus building around the right types of metrics we need to be tracking, the right types of measures we need to have in place to be ready to start to open back up.
Are you starting to see, this was a question online, best practices from the retail stores that have been open that would then translate into other types of businesses? And how they could operate?
Yeah, I mean, I'll tell you, there's been an incredible amount of activity in our manufacturing sector, in particular in Connecticut, of companies that have been kind of retooling what they do to produce PPE, as an example, or hand sanitizer. We've got orders placed with the state with a number of our own homegrown manufacturers have retooled their assembly lines, and we're buying stuff as fast as they can produce it. Masks, in particular, face shields, sanitizer. So there's been a lot of change, in our manufacturing sector in particular in response to this. I'm sure the way, retail will evolve over time, at least until we really get past this with a vaccine and a high percentage of the population has built up immunity. I'm sure we'll see a very different way of doing business for a while.
Any type of timeline on making decisions for the reopening, or even doesn't have to be a full reopening, but where you could see some more guidance or a specific plan on how businesses should start to get ready? Any type of timeline you could give? Well,
we're gonna talk later this week in the governor's press conference with this advisory board about some of the frameworks that we're thinking about for this. In terms of getting down to the real nitty-gritty specifics of when businesses should expect to receive very specific guidance about timelines and stuff, I think that's still going to be a little further down the road. We haven't even peaked the crest of the hospitalizations and the infections rate. And you can't even start talking about taking actions, unfortunately, until we start seeing significant declines in the infection rate and hospitalizations. So it's, unfortunately still going to be a ways off. The governor, as folks saw, extended that reopen date to at least May 20th. But, even that is an estimate at this point, and we'll have to see as we get closer whether, we're seeing the infections and the hospitalizations start to decline to a point where it is safe to start to pull some of those levers, but we just don't have no one has visibility to that yet.
Josh, I'll leave you this last question, and then anything else you want to just add. Schools obviously is a big part of what occurs for reopening, because people have to have places to put their kids and that. So any new guidance on the school system? I believe May 20th, we're out to that date as well on schools, and then anything else you want to leave us with?
No, I mean, that's really it. And, look, I mean, I know a lot of people are frustrated right now because we all want more clarity about when can I reopen my business? When can my kids go back to school? When can life start to get back to normal? Everybody wants the same thing. And, unfortunately, nobody has been through this before, and nobody has the answers. No country, no state. We do get to benefit to some degree by the fact that some other countries have gotten into this before us and have now started experiments on reopening. And, we can learn from those, both the good and the bad. Unfortunately, some of the countries in Asia that have started to reopen have seen some flare-ups and have had to ratchet it back down. So, look, I really wish we could give people more specificity right now in terms of timelines and dates and what happens in what order. But that's what we're working on. And, first things first, as the governor says every day, we've got to stay up on the social distancing, get that infection rate down so that our healthcare system can have the capacity to not be overwhelmed, because when that happens, more people die. And we have the opportunity to save lives, and that's the top priority right now. But we do know the economic toll and devastation that this is causing for people right now. And we're all trying our hardest to get to the point where we can start to undo that as quickly as possible.
Well, Josh, I appreciate your time. I know you're on a tight schedule and you have a lot of things going on. So thanks for taking a few minutes with us today.
You got it. And thanks again to everybody for everything you're doing and the difficult times that you're dealing with. It's greatly appreciated. Thanks, everybody.
All right, thank you again. We will have another webinar tomorrow at 1 o'clock, navigating some of the stimulus packages out there. We appreciate Josh joining us. And again, we have our leadership graduation this afternoon. Thank you again, everyone, for joining us. We'll have a recording of this on our website along with our other webinars that we put together. Thanks again.